Hello everyone. Happy last day of 2025. Actually आज का टॉपिक थोड़ा सीरियस हो गया. Maybe not the best choice for the last day of the year, but क्या करें. Some of the incidents that have happened over the past week or so, I had to sit and understand those, and then come up with some way to present all the material to you so that it doesn't get too boring. But again, ये टॉपिक इतना सीरियस है कि इसमें बोरिंग इंटरेस्टिंग का सवाल ही नहीं खड़ा होता है. I do want the audience to be engaged, but I do want the audience to also reflect on where we are as Canadians as we draw to the close of 2025, right? क्योंकि where we are in terms of how the world is structured right now, I don't necessarily look at 2026 as a huge improvement to 2025, right? All the variables, quote unquote, that are causing the most variability in the world are going to be there in 2026. We may expect some of them to maybe go down slightly, or maybe reach some sort of conclusions like the Russia-Ukraine war. The tariffs should stabilize in some form so that there is more clarity on kitna hai, kitna nahi hai. But again, there's a lot of things that are coming up that are gonna keep the coming year very interesting, to say the least. मतलब interesting तो क्या, it's gonna be more and more complicated only. It's I'm not expecting a reduction in the amount of complication we can expect. So with that in mind, I said, okay, there is a very Canadian topic that I can cover, and this I'll keep most of this video in English. I'll try not to switch it over into Hindi at any point because I want as many people to be able to watch this one and poke holes, right? Like at the end of the day, I want feedback. Like what I have gotten wrong is what I've gotten wrong. But what I've gotten right, I would like people to just watch, reflect, and see what could possibly be done to rectify the situation moving forward. Now, for those of you who saw the thumbnail already, you know what we're going to talk about. We're going to talk about the Canadian healthcare system. And this is going to be a deep dive video. It's going to take time. It's going to be a little long, and at times it'll look very numbers heavy, very very technical, and at times it's also going to be very sad. So brace yourselves, and if this kind of content is not for you, especially for the last day of the year, feel free. आप stream छोड़ सकते हैं. You can drop off. No hard feelings or anything. So yeah, let's get started. I'll go over some background. I'll go over what the actual situation is, supported with a lot of data. As always, all the sources are in the description. None of this is concocted. None of this is conjecture. This is all information in the public domain, and you are free to go and verify for yourself, read these articles, documents for yourself, and then draw your own conclusions as well. As always, if you think there is anything interesting, please do leave a comment. If you think there's anything wrong, please also leave a comment. I'm happy to rectify myself. And yeah, if you don't like something, please be candid and open about it as well. All right, let's get started for this one. Okay, yep. So I think we all know this incident by now. This happened in Edmonton, and a gentleman by the name of Prashant Shri Kumar, he went to an emergency room in Edmonton. He was he basically complained of a chest pain. Um, Looks like there was some tests done, ECG taken, blood pressure taken. Looks like all those tests were in a normal range, in an expected range. So they told he was triaged accordingly. That's what happens, at least in Canadian emergency rooms, when you go based on the symptoms you're presenting. There's a triaging nurse who decides when you will get priority, when you will be able to see the doctor. Now, on surface, this system is fine because okay, if you have minor symptoms, okay, you can maybe wait a little longer than someone who needs help very urgently. But of course, what happens is sometimes the system's symptoms may not be telling the full story, and that's where the system breaks down. The concern here is why such a system is even needed, and that's because of all the overcrowding that's happening across ERs, clinics, every medical attention facility you can think of all across Canada. So before we get into those details, let's go over um, this incident a bit. So he he's a father of, or he was a father of three kids, and of course his wife. They are a family of five people. Looks like at the time of his passing, I think his dad was also there, maybe staying with them, living with them permanently. We don't know. Also, not relevant to the to what has happened here. He spent 8 hours in an Edmonton emergency waiting room. I'm just quickly going over the article headline that I have in our slide over here. Um, his wife has said that Prashant continued to wait for care despite worsening pain that made it difficult for him to stand, sit, and breathe. He collapsed and died a short time after being admitted to a room. Um, Dr. Raj Sharman, a veteran Edmonton emergency physician and former Alberta Liberal Party leader, called Prashant's death absolutely horrendous and tragic. He says, us in the front lines make no bones about it. Every day we walk into our shift and go, oh God, help us. I hope nobody dies in the waiting room. They have been saying this for decades that Alberta's ERs are crowded. Um, yeah, this is a lot of things that we have heard across Canada. So let me just quickly make sure that I've covered the slide at least. Okay, I will move myself out of the way a bit. Okay. Now, this is a part of the statement that was released. We are released by the hospital, Covenant Health. We're deeply saddened regarding the death of a 44-year-old male patient at the Grey Nuns Community Hospital in Edmonton on December 22nd, 2025. We offer our sympathy to the patient's family and friends. There's nothing more important than the safety and care of our patients and staff. Sorry. We're all Canadian citizens. We have worked and paid so much into the tax bucket in this country, and the one time Prashant needed medical help, he was not given it, Shri Kumar said. For reference, Shri Kumar is the gentleman's wife and the mother of the three kids that they have. Now, she's of course demanding for justice in some form or the other, which is, well, which is entirely expected. Um, First and foremost, before I go too much into this whole topic, my sincerest condolences to the family who have lost their loved one, who have lost maybe yeah who have lost this person who was a pivotal member of the family. Um, yeah, I don't know how to exactly entirely give entirely say anything more on this, but yeah, I hope they're able to find strength as they go through this time, and I hope that they are able to sort of they're able to eventually get back to some form of normalcy in their lives as they start moving past this incident. But yeah, sincerest of condolences to the entire family, and I hope things continue to get better as we progress into 2026 for them. Okay, let's move to the next one, because this is again I have a lot of things to talk about in this respect. Now, of course, on the top left, what you're seeing here, a man died after waiting 8 hours in an Edmonton ER. How did the system get here? This is the fundamental question that we will be trying to answer throughout this live. Another incident, just to jog everyone's memory, this happened towards the beginning of the year, Jan 15, 2025. There was an article where we are seeing a Hunger Games across Ontario. Hundreds in this town line up for a chance at a family doctor. People in Walkerton showed up to register after word went out Dr. Mitchell Curie was taking patients. So my own story here is that I've been wanting to get a family doctor since I think 2021 when I moved to the Vancouver area in BC. And literally, my wife and I just got a family doctor assigned to us about a month back. So, waiting time 5 years. This is not data. This is not. You could call it anecdotal, but yeah, this is my own experience. This is my 2 cents into this whole issue, and I'll be dropping a few more cents as we go along. But I don't see up front, I want to mention this because I have been, for various reasons, I have been to an emergency room a couple of times over the past 5 years, right? Sometimes I'm helping a friend, sometimes I'm helping myself. When you see the medical staff there, the nurses, the doctors, the physicians, whoever is making that emergency room run, they are bloody exhausted all the time. And the pace at which they are having to see patients, make a decision, prescribe medication if needed, decide if they need a bed, it's it's heart-wrenching. I feel bad for them, even though I just waited 5 to 6 hours to get any medical attention. By the time I actually get to see a doctor, by the time I see the doctor's face, I'm just like, oh man, I hope you are fine. Because you can, one thing is, okay, you come back from your job 9 to 5 and you're just tired, you're mentally exhausted. One thing, and the other thing is you see that exhaustion on their face, and it's just, you don't need to be a face reader to be able to uh, decipher that. You just see them, they're so exhausted. So even though you're frustrated that I waited 6 hours to be able to get some help, You see the doctor, the nurse attending to you, you're like, oh God, okay, I understand. But again, there is something definitely not correct. Like you're waiting 6 hours and you're not even able to see someone who is fresh, who is maybe even at least enjoying their jobs. You see the other side also so tired that you're like, यार अब मैं क्या ही complain करूँ? What can I even say? It's not their fault. I can see that on their faces, and I can see that from the rush in the ER. And meanwhile, the urgent care clinics, everything's just packed all the time, packed up, backed up, right? So where do you even go? There is no alternative. Anyway, let's move forward. Now, the scale of the issue. So, this is actually a report by Fraser Institute, um, and they have highlighted the wait times for healthcare in Canada. This is a 2025 report. This is as latest as it gets, and this is coming from a very, very uh, reputed organization, the Fraser Institute. And again, link in the description so that you can go read this document on your own. Let me make sure I can just adjust myself a little bit. Okay, yeah, this way none of the text will go away. In 2025, physicians across Canada reported a median wait time of 28.6 weeks between a referral from a general practitioner and receipt of treatment, down from 30 weeks in 2024. So, this is supposed to be maybe a nice thing because at least it's a drop. But to put this in perspective, 28.6 weeks wait time is half a year, more than half a year, right? 6 months, roughly speaking, 24, 25 weeks. This is slightly above that. This is almost 7 months. This is 208% longer than the 9.3-week wait Canadian patients could expect in 1993. More on this coming up, but we'll just keep this as a thought for now. Wait times have decreased in Alberta, Saskatchewan, Ontario, New Brunswick, Prince Edward Island, while increasing in other 5 provinces. So I guess that includes BC, Quebec, Manitoba, Newfoundland, Labrador, and okay. Now, firstly, a 208% increase since 1993. That in itself is alarming. But other than that, the incident that we just discussed of the gentleman's passing, that actually happened in Alberta. So it looks like after the wait time has decreased, it's still, well, yeah, it's a decrease, but it's your starting point itself is so ridiculous that it doesn't matter at this point. Ontario reported the shortest total wait, followed by BC and Quebec. So Ontario seems to enjoy at least, they have a long head start. Now, this is not a surprise per se, just because Ontario has the highest population. GTA has about 8 million people, so everything over there just sort of, it makes sense. BC 32.2 weeks. We'll discuss BC in a little more detail as we go forward, but yeah, that's because no, the cost of living in the biggest metropolitan area of BC, which is Greater Vancouver area, is so ridiculous that, like, the first chance people get to leave, they leave. And I would say that this is probably, I've done a lot of lives talking about Canada emigration, while Ontario has the highest number, as a proportion, BC is the highest. and this is reflecting in this statistic, because a lot of the people who are emigrating will also be doctors or healthcare providers of some sort. Quebec, I don't want to go into it because I don't understand Quebec much. Patients waited longest in New Brunswick. So yeah, might as well. Yeah, I guess New Brunswick. They one thing is it's interesting to see, right? New Brunswick and Prince Edward Island are two of the provinces where the report says the wait times have decreased, and after the decrease, it's 61 weeks and 50 weeks. Nova Scotia 49 weeks. I guess that was the one I missed when we were talking about the other five where it increased. This is shocking. After a decrease in wait times, it's come down to 61 and 50. Now this story is going to get more ridiculous as we move on. The national 28.6-week total wait comprises of two segments: referral by a GP to consultation with a specialist, which is 15.3 weeks. Okay, consultation with a specialist to receipt of treatment, which is 13.3 weeks, a decrease from the 15 weeks recorded in 2024. So one first is, okay, you get to see a specialist. Second is, okay, once a specialist sees you, then when will you get your treatment? Oh wow. Among the various specialties, patients waited the longest for neurosurgery and orthopedic surgery. By contrast, patients faced shorter waits for radiation oncology and medical oncology. Okay, that's it. That's at least, I guess, if you're getting your oncology attention quicker, at least that's a positive sign overall. But I guess in an oncology case, you don't have the liberty to wait anyway. So, not to say that in neurosurgery and orthopedic you can wait, but yeah, I mean, it's there's no relief here just because one department seems to be doing better, much better than the other. It doesn't mean it's there is no cause for celebration even after seeing that statistic. Patients also suffered considerable delays for diagnostic technology: 8.8 weeks for a CT scan, 18 weeks for an MRI, 5.4 weeks for ultrasound. These are basic things. These are, medically speaking, very normal, basic things you expect. In fact, if I were in India, I would get it pretty much same day, maybe a week, 2 weeks. I've had a CT scan in India, I've had an MRI scan in India, well, not an ultrasound yet, but at least a CT and an MRI, and yeah, it was basically next day or maybe a week later. Just 8.8 weeks. 18 weeks for MRI. Okay. Across 10 provinces, the study estimated that patients in Canada were waiting for 1.4 million procedures in 2025. Population of Canada recently has been recorded at about 41 million, right? So let's do a quick divided by that's about 3.4% of the population. This is, of course, assuming one person, one procedure. So 3.4% of the population, roughly speaking, is waiting for some sort of a procedure in 2025. Now, this is just describing, as I've titled this slide, it's the scale of the issue. It's not talking about why we have gotten here necessarily, but this is just to showcase to everyone just how bad it actually is. Sometimes you read an article in the newspaper, you feel ki what if this is some way exaggerated? What if this is some way not, you know, at the end of the day, you write an article, you have to make it so that people read it. But what I'm trying to do here is saying very clearly, no, no, this is the real problem. This is a real problem. There's no way to exaggerate it, and it can be seen in the data from the this is and Fraser Institute is not getting data by, they're not, they probably do their own surveys, like everything. I don't know their methodology, but they also look at Statistics Canada for all this data. They also look at government sources. So this is all public domain, just summarized for everyone to be able to see where we actually are. When we have to claim that 60.9 weeks is a reduction, then yeah, this is beyond crazy. This is beyond, this is downright delusional. It feels like this is coming from a dystopian movie of some sort. But again, this is all real data. Again, all sources in the description. Let's move. Another thing, another slide for scale of the issue, um, just to show where we were in 1993 and now where we are in 2025. Needless to say, all the light green bars have gone up tremendously. Ontario probably spared because of the amount of, because of being the financial capital of the country. At the bottom, you will see the entire country. So 9.3 weeks to 28.6 weeks. I mean, 9.3 weeks, probably not the best starting point anyway. It should be a little faster than that. But okay, at least it's fine. You will get most of the cases. I would guess. I'm not a doctor, but fine. 9 weeks, you could pretty much cure anything, maybe except some very urgent diseases like cancer or neurological disorders, cardio disorders. I guess in any field you can have disorders which are gonna just be, you have to treat them now. But I guess I would still say, okay, 9.3 is way more acceptable than 28.6. Of course, BC, Alberta, Saskatchewan all have increased tremendously. The worst we see is obviously, I would say, New Brunswick, 12.3 to 61. And not too far behind are Newfoundland, and let's say Nova Scotia and Prince Edward Island. Okay, let's move. Now let's look at some OECD rankings and where Canada is sitting. There are some positives in this, and again, I encourage everyone to look at that, where Canada is doing better in terms of life expectancy, slight margins, but at least better than OECD average. But right now we are discussing more on the issues with the healthcare system. So let's look at some of these statistics. Yeah, this is a little complicated visual, so I've kept the whole legend here. OECD average, other OECD countries. So we will see OECD average as a gray, and then the Canadian ranking either as a green, red, a dark blue, or a light blue dot. Quality of care, antibiotic prescribing, very close to, much worse than the average, kind of closer to the lower end. So this is considered better. 30-day AMI mortality, this is also better than the OECD average. Hip fracture surgery within 2 days, that's also a positive for Canada. Obstetric trauma is way, Canada is basically absolutely the worst on this. Access to care out of pocket 14. This is quote unquote better than the average OECD. That's because in Canada, almost all healthcare is socialized, so you just pay for it through your taxes. Share of generics 78.1, again good. Searching health information online, that is pretty good, I have to give them that. Satisfaction with coverage 56, which is expected given what we just saw on the wait times. If you're waiting on average close to 30 weeks to get treatment, then yeah, you're not going to be very satisfied with the coverage. Now let's get into the more interesting things. Health system resources. Expenditure as percentage of GDP. Please note this I believe is 2023 data. This is not exactly 2025 updated, but this is the latest we have in terms of reporting available. Expenditure as percentage of GDP 11.2, which is quite a bit higher, not the highest as a percentage of GDP, but still higher than the OECD average. Practicing doctors per 1,000, we are going to dissect this a lot more, but this is much lower than the average. And this is actually fairly close to the bottom. This is almost 1 point, with the maximum being 6.3, right? So the average is lower in general, but Canada is even farther to the left, quite a bit farther to the left. Medical graduates decreasing, it looks like, but the lowest is, I guess, 6.8. Canada is barely producing, slightly more than that. Nursing graduates is actually higher than the average. So here is where we are seeing a mismatch. Nurses are assistants to surgeons and practitioners. They can do, I guess they could if they had to be able to diagnose, but I don't think they officially can diagnose any ailments. That has to be done by a doctor. And on doctor and medical graduates, Canada is significantly lower. So here is where we are seeing a little bit of what the mismatch is. Now this is again on a very technical level, right? You're spending, so one point is clear that we are spending a lot more as a percentage of our GDP, and we are not seeing enough doctors and medical graduates going into the system. We are seeing more nurses, but nurses can only go so far. They can take care of you, they can do simple technical procedures, but they are not allowed to ultimately make a call on, okay, this is the disease, okay, this is the surgery, etc., etc. They don't get to do all that. I know this for a fact because one of my close friends is a nurse, but more than that, I have been to hospitals myself. I know where the responsibility of a nurse stops and the responsibility of a doctor begins. And I mean, this is not even rocket science. So let's go forward. Here we, again, just to, if there's anything you take away from this slide is, well, first we see, okay, out of pocket, pretty good, but the overall satisfaction with coverage, very low. Well, not very low, I guess, compared to the OECD average, but still a fair bit lower. We are spending a lot on this healthcare system. Doctors per 1,000 people is significantly lower, and medical graduates is also significantly lower than the OECD average. So we are spending a lot of money, we are not having enough doctors, we are not having enough medical graduates, and we have, well, more nursing graduates than the OECD average. Is this an oversupply or not? I'm not going to make a statement on that. I don't know. I'm pretty sure this is still an undersupply scenario given the state of the ERs we see. But again, I'm not going to make a definitive conclusion simply because I don't know. Now let's look at what the spend on healthcare is. Let's dissect this a bit further. Canada's healthcare system is the third most expensive but ranks 27th for doctor availability compared to other developed countries. This is a study, again, linked in the description. And this came out on 23rd October 2025. So this is very, very, very recent data. Now, as we go into this, right, so now projected GDP of Canada for 2025 is 2.25 trillion. And if we just go back one slide, if we are spending 11.2% of our GDP, I'll do a quick calculation. Sorry, what was it? 11.2. Okay. So what is 11 point? So this is $252 billion go into our healthcare system every year. Rough back of the paper, back of the envelope calculation, 11.2% of 2.25 trillion, $250 billion. This is USD, this is not CAD. Now, Canada spends the third most on healthcare compared to other high-income countries, with universal healthcare yet ranks near the bottom across a number of key metrics. According to a new research study from the Fraser Institute, this is the one that I mentioned in the past slides. More on this maybe coming up. These include the availability of doctors, care beds, MRI, and CT scanners. So we already saw all this come up in the data because we are seeing the waiting times for MRI and CT scanners are just goddamn ridiculous. They are so ridiculous that you might as well, like, you can't even, it's gotten into that realm of ridiculousness that there's no point even crying about it. It's just ridiculous. Clearly, there's an imbalance between what Canadians receive in return for the relatively high amount of money they spend on their healthcare system. Mackenzie Moore, author of the study and Fraser Institute's senior policy analyst, concluded in reviewing his research. The study found Canada was below average compared to universal healthcare systems of 30 other OECD countries and across 13 indicators. Reviewed for medical resources and timely access to medical services. So this goes back to, since all these indicators, Canada is faring poorly. That's why the satisfaction with coverage is 56, even though Canada spends the third most on healthcare compared to other high income countries. So the question that begs to be asked is, where is the money going? We are spending a lot, but we are definitely not getting what we are putting into this system. So, okay, the money is going somewhere. It's not just, it doesn't just disappear, right? So, let's go into that. 1 second, guys, sorry. Yeah. Let's go one layer deeper on what can be some of the causes of all these misbalanced data, right? What we are seeing is that the number of doctors per 1,000 is a lot lower. And what we are seeing is number of medical graduates is lower, but we are seeing more nurses. So let's zoom in on the doctors per 1,000 getting lower. A lot of this may not be even the most shocking, but let's go over step by step, right? So population of Canada from 2015, sorry, you will see that some of these titles on the x-axis are cut off, but this is just the population growth. Now between 2021 and 2024, we see a huge increase in population. We started at somewhere about 37.5 million all the way to about 41. Now, when the population increases so quickly, now the cumulative or the compounded annual growth rate over the past 10 years, 2015 to 2025, was about 2%. And much of that growth has basically come from 2021 to 2024. Now, obviously, when you have more people, you're going to have more people who may need to visit a hospital. So that's one source of the overburdening of the system. The second chart I want to point to is at the sort of the bottom right side of the slide. Here, this is coming straight from Statistics Canada. Nothing, I didn't plot this one on anything. Even the one on the top, I plotted it, but again, downloaded the data from Statistics Canada. Nothing made up here, right? And all publicly available data. None of this is conjecture. Number of physicians, we started with about 50,000 in 1998, and we are sort of close, maybe slightly over the 100,000 line. Mota, broadly speaking, we have about 100,000 physicians as of 2024. This may have gone up significantly in 2025. I don't know, right? While we are seeing nurse aides, orderlies, and patient service associates literally more than doubling. We started about 140,000. We go up to about 280, right? Yeah, if I'm not okay, about 250K, close to doubling. And then we start with nursing occupations. So we started about 300,000, and now we are literally reaching 500,000. Not exactly there, but yeah, I guess 450,000. So there's a clear imbalance between the number of physicians that we have in the country, which, well, quote unquote, has doubled, but the denominator is so low that, okay, that doubling is obviously not enough. On the other hand, we have a lot of nurses. Again, nurses are important, there's no denying that, but nurses don't make diagnoses. Nurses provide care, nurses can run simple procedures. Nurses sometimes know what medication the patient may need, but they can't prescribe it. They can administer it once it's been prescribed, but they don't get to prescribe it, right? Some more data to look at. Median salary of a nurse, $125,000. Median salary of a nurse/physician. Okay, I'll have to check that. 208K. Total healthcare sector employment, 2.1 million people. That is, roughly speaking, if we take the latest number, 42 million. Okay, so okay, so 5% of so 5% of Canada's overall population, not, this includes babies, kids, everyone who's not even maybe looking for a job or retired, everything put together, 5% of entire Canada is employed by the healthcare sector. 5% is not a trivial number. I'm just putting this quote here for everyone to read. Us in the front lines make no bones about it. Every day we walk into our shifts and go, oh God, help us. I hope nobody dies in the waiting room. That's again because there is such a shortage of physicians. Yeah, I'll just put myself here. Okay, no worries, I can just see. Again, we start with 50,000 physicians, go up to 100K. Seem to have doubled, but the denominator itself is smaller. Nurses, almost, well, we start with 300K. almost at 450, slightly above maybe. And then all the other nurse aides, orderlies, patient services more than doubled as well. So about 140, you're going up to almost 300K, maybe slightly lower, 250K. So now this is making the mismatch more obvious, right? Like, let me do this, and then I can just leave myself here safely. Because yeah, okay. So yeah, let me just put myself here. So I think we have spent enough time here. Let's move on. Okay. Meanwhile, earlier this year, I had covered an article on more than 27,000 public servants were paid 150,000 or more last year. So to be clear, this is all public servants, of which healthcare is a part. It's not all of them are healthcare workers, but they are a part of this, right? So we are seeing that, okay, there are 27,000. Yeah, let's assume we can do a back of the envelope again. We say 5% of 27,000. So that would lead to, quickly, let me do this one. Assuming it's about the same percentage. So we are seeing, roughly speaking, about 1,350 healthcare workers have maybe got more than 150,000 or more last year. I don't think that number makes any sense, just because a lot of the healthcare professionals actually just have to earn more than 100K to even be able to do their jobs effectively. Like, otherwise, they don't have any incentive. Now, meanwhile, we also see an imbalance in what we could call the salary of the non-management, uh, the non-managerial class, right, of the healthcare workers, which is paramedics, which is a median at 75K a year, pharmacist 130K a year, which is okay, fair enough, medical assistants 38K, healthcare orderlies 48K. We had a strike. This is for BC. This is not for Alberta, to be clear, but BC government employees strike is over. Here's what comes next. They had requested a total of 12.6% salary increase, which came up to, I guess, about 3% over the 4 years. Just to be clear, their demand was actually not too far off the average inflation for the past 4 years, which is sitting at 3.7%, right? So a lot of the times, unions in Canada face a lot of flack, but in this one case, I would say they were not wrong. Yeah, there could be an issue with over unionization and whatnot, but at least in this one aspect, I don't think they were wrong. To expect a salary increase in line with inflation after seeing these numbers like paramedic, pharmacist, medical assistants. Apart from the pharmacist, I'm not seeing any salary that is crazily high or anything. 74K, if you're, I guess in the GVA area, it'll be more. This is a median number. But regardless, asking for a 3% increase when the average has been 3.7, that is totally in line with inflation. They're perhaps making slightly lesser than they were 4 years ago, because 3% per year compounds to 12.6, whereas if we have 3.7%, that takes it over 13-14%, right? BC Paramedics Union warns of possibility of strike. This is again an article that showed up. This represents 4,500 ambulance paramedics and dispatchers, saying collective agreement negotiations with its employer, the provincially run BC Emergency Health Services, began in September. Let's hope we don't see another strike. Let's hope we don't see another healthcare related strike. Um, because it looks like even at full capacity, it's nowhere near enough. Right? It's nowhere near enough. So, the road forward, as I've said earlier, is that there is a lot of administrative bloat across Canada, not just in healthcare, but in all other aspects, right? Now, this is something worth looking at. BC Healthcare Review cuts 1,100 position, redirects 60 million toward front lines. So I'll just bring myself to the screen and talk for a little bit now. You know, I think we can clearly see that there is a lot of administrative overload. I don't know if the absolute number of physicians we have is that correct, is that not correct. I have no way to know that, right? I'm not a medical practitioner, so I'm not. I'm just going to keep my mouth shut on those things. I have mentioned this story in a couple of my other lives. You know, I recently got COVID again, right? I took the flu shot, but I still felt feverish, viral, the symptoms you get all the time. So I held for a day and a half. I thought it'll go away, but the weekend rolled by, and the Sunday of that weekend was horrifying for me, right? I'm just feeling like, oh my God. So I go to my usual clinic. Turns out it's closed for Sundays. Okay, my fault. I should have checked. I should have looked at the timing correctly before I drove all the way out. It's about 30 odd kilometers from here. And the reason I go to that one is because there is never any availability in the ones around where I live. It's yeah, it's there's no point even going. Like, I've been to the ERs, right? 6 hour waits. So I go to that clinic. Clinic is closed. So then in desperation, I'm like, okay, now I'm going to look for a walk-in clinic nearer to my house. I find one. Right? Today I don't want to take the name because I've taken that name before, but today it's not about a specific clinic. It's not about one specific incident. It's not about it's it's not about something that happened to me or something that happened to one other person. It's about the entire system just crumbling because of administrative overload on one side and a massive population increase on the other. And even though overall 5% of Canada is employed in the healthcare sector, 5% of entire Canada, not the working population. Please note, 2.1 million of 42 million is 5%. Let that sink in for everyone, right? So, with so much employment, with so many people associated with this sector, we are seeing such kind of news coming from Alberta. We are seeing such news in BC. And I've showed data on what wait times look like across the whole country. Might as well, New Brunswick people should just stop falling sick. They don't have a choice, right? So with Nova Scotia. In Ontario, you are lucky enough that, okay, 20 weeks, which is also 5 months, which is nothing to be proud of, but it's so much lower than the rest of the country that it almost seems like a blessing, right? So it looks like the problem has been identified. At least when I see such articles that I showed um, about the about BC deploying $60 million to the front line. Um, at least it looks like the problem is being looked at. Again, I did a whole deep dive live on the budget of Canada that came up. A few days ago, there was another article where it said, um, come the new year, there will be cuts in the federal administration positions. See, all of this seems to be going in the right direction, but one piece of the puzzle I'm not seeing whatsoever is why are private players not being encouraged to get into healthcare? And this is the other side of the coin where the unionization comes in a negative way. Sure, when they ask for a salary increase, it's in line with average inflation, so you can't fault them for it, especially after seeing some of the median salary numbers which are which are not that high, honestly. You wanted to live in greater Vancouver area, you easily need 80 to 90K a year. Otherwise, you won't be able to make ends meet. Forget it. I'm pretty sure the median is probably lower, but I'm just saying for a decent lifestyle in the GVA area, it'll be about 80 to 90K. In the GTA, Greater Toronto area, it'll be about the same. Yeah, you can, it's about where you end up paying. Ontario has more expensive utilities, higher insurance rates, but overall maybe lower income taxes. In BC, your income taxes could be lower, your utilities are lower, but you're paying more for gas, etc., etc. So in Hindi we have a saying, right? किस तरीके से गर्दन पकड़नी है, गर्दन तो पकड़ी ही जाएगी. Your neck is gonna get caught regardless. It depends. You want to just do it this way, or you want to come around and try and do it. It's expensive, no matter where you look at. I don't know much about the Montreal area. I'm not going to talk about it because I've just not been there enough to have any meaningful commentary. But again, between uh, between Ontario and BC, I'm literally speaking for about 50% of the people in the country anyway. And now we have seen this horrifying case come out of Alberta, which is supposed to be the most conservatively run province, most fiscally disciplined. Anyway, I've never lived in Alberta. I've only visited Banff, so I can't speak in detail. But if Alberta, what do I say, right? I would have expected not to see such news from Alberta. I don't know, especially because of the image that it has across the country. But again, this piece of news came from there, so yeah, think about 28.9 weeks average wait time. When I decided to go to that clinic to get checked for COVID, the walk-in clinic, when you type in Google, it says walk-in clinic. I went to a walk-in clinic near where I live in the Greater Vancouver area. That walk-in clinic does not take walk-in patients anymore. Yeah, I went to a walk-in clinic that does not take walk-in patients anymore. Firstly, I don't understand why not. If someone's in pain, they've come to your fucking clinic, at least make them sit and okay, a doctor will see you. All I saw was a person sitting behind a screen. They pointed me towards a goddamn touch screen. Go put in your name, all this bullshit. And then, have you been here before? No. In this case, it's a she, not even bothered. not even goddamn bothered to look at my face, right? Last year, I had to go for a medical emergency that happened. I waited 6 hours. Granted, granted, the situation I was in was not anywhere near as horrifying as what we just saw in the Edmonton case. It was just something I'd never dealt with before. I got scared, so I ended up in the ER. And it's okay that I waited 6 hours that day. It's fine. I accept it. But when I went and saw, when I finally got the attention, it took my case about 20 minutes. The doctors and the nurses were tired. They were exhausted to the bone. You could see that they had to keep the smile on their faces just because, it's a patient. They have come to get some medical attention. They're not going to be rude to you, right? At least they shouldn't be. So they were doing their jobs just as best as they could. Hats off to the doctors, physicians, nurses, and all the medical care staff that does their job in literally conditions where, it's almost scary conditions. But there has to be some soul searching that needs to be done at the managerial levels of these health care institutes all across the country. Literally, there simply has to be, you know, back in August, I didn't put up this article because I thought it would be, well, just too much, but we are at good time. So, the severance package of one of the directors was more than $500,000. This person was relieved from their position, I think in August, or at least the article was in August. I don't know when the actual relieving of their duties happened. They got more than $500,000 as a severance package. Meanwhile, your paramedics, all these other, let's go back. I'll put that slide up for a bit real quick. Yeah. Meanwhile, a paramedic makes 74K median. Pharmacist makes 130K. Medical assistants are making 38K. Healthcare orderlies are making 48K. And then nurses about 124K. That is nothing short of shameful. Right? Nothing short of shameful. Having said that, though, as I showed on the last slide, and as I mentioned during the budget live, it looks like the problem has been identified. It looks like solutions are being tried out with some sincerity. However, not everything that can be done is being done. I think if Canadians get a choice, okay, we will, to be even more critical, right? We pay for this medical system through our taxes. That's one thing. But not everything that can go wrong with you is covered by this socialized healthcare system. We still pay additional from our income for medical insurance on vision, dental, etc., etc. Last, I think during Prime Minister Trudeau's administration, they had some sort of a dental care plan. Very few people qualified for it just because of the income levels they had put in. But at least if you want to be socialized, then be completely socialized. Then I don't have to worry about getting other healthcare, other insurance, right? I still pay for medical insurance for about 20% to 30% of things that could go wrong with a person. I wear specs. I'll need a I'll want to maybe get them replaced every 3 years or so. Okay, out of pocket. Medication, out of pocket. When I say out of pocket, I don't mean the full cost. I mean insurance premium, right? Now, we are seeing a growth in some sort of. Let me see if I have that point here. Let me see if I put that. Okay, yeah. So the highest growth we are seeing in the healthcare sector is in psychotherapists, nurses, and paramedics. So I think the nurses and paramedics one is quite clear from chart 2, and the highest growth when it comes to sort of doctors is in psychotherapists and counselors. Look, I have all the respect in the world for psychotherapists and counselors, but the fact of the matter is, if there's a physical emergency with me, a counselor can't do anything. Right? What we need is trained, more trained doctors in specialty fields that have to do with physical ailments that require immediate attention, physical diseases, right? And for these physicians to then continue to stay in Canada, to work in Canada, to continuously provide their services here, than emigrate, they just have to be paid more. And the way they get paid more is when private players are allowed in this. I'm not saying you take away the socialized healthcare, but at least provide an option. If there is an option, then people who have private insurance will just go to the private hospitals. It will reduce the burden on the government run hospitals, and everyone gets to win. Right? Yes, there are issues with that model, but those issues will pop up after you have such a system in place for 20, 30 years. At least right now, the immediate need of the hour, in my opinion, is to let private players in so that the burden on the government system goes down. Ultimately, I don't care what the executives make as long as there is a doctor to look at me when I need the doctor to look at me. Right? I don't even know what could. I've never been in a situation like this, and I hope I never end up in a situation like this. But I live in BC, right? What if I'm visiting Ontario, Toronto? I have friends in Toronto. I'm visiting there. Something happens to me. I go to an Ontario hospital. I don't have an OHIP card. I have a BC MSP card. I don't even know what will happen in that case. I have no idea. I'm pretty sure there is a system in place for it. It's not that no one thought about it. But instead, if I were just paying for private healthcare, doctors in network, hospitals in network, I just go to a hospital, it's in network, and there I go. I don't have to worry about it. Right now, I have a BC card, MSP card, and I don't know how things will pan out if I show up to a hospital in another province, in another clinic. Maybe I don't need to go to an emergency room. Maybe my situation is not so dire that I need to go to an emergency room. Like with COVID, it's just I'm feeling feverish, but I want to make sure it's nothing else than just a fever. So I'll go to a clinic. I don't know what will happen if I go to a clinic in another province with a BC MSP card. I have no idea. To be clear, there are clinics all over BC that literally list out rates for out of province people or for out of country people. And again, going back to these taxes we pay to not cover everything, guess what? You want to get a vitamin checkup? All vitamins are not created equal, apparently, right? So, vitamin D, $75 extra. Yeah, paid out of pocket. Even though I have, of course, I have a BCMSP card. I don't know in which, I don't know where in the world you have to pay more to get a certain vitamin tested, and that to vitamin D, $75 extra. You need a doctor's note, $30. Those are the rates I have paid. And what doctor's note? What's a doctor's note? A piece of paper printed out saying, yeah, this person was actually sick. Here is the confirmation of that. $30 for that. Anyway, guys, I think enough. enough. Yeah, enough for today. Enough for at least this episode of today. I hope everyone has a great New Year's Eve, and everyone has a great start to 2026. I also hope that this talk, if it ever reaches you, if you ever end up watching this, especially if you're Canadian, um, it makes you reflect, it makes you think, it makes you understand all the facets of the problem we are in, and then there can be some sort of a healthy intellectual debate, either amongst yourselves or through the comments or anything, that you know or maybe there is a way to actually reach out to the political class, request them, you know why are we not letting private players come in? Why can't we have a hybrid system? Why do we have to have the government in this from start to end? All right, guys, I'll conclude for the day. Hope you have a great rest of the day wherever you're watching in the world. And if you're in a part of the world where it's already 1st January, then very, very, very happy New Year. For the ones that are here in North America, I'll be annoying all of you tomorrow as well. So stay tuned for that. Have a great rest of the day. Bye bye.